Good morning. Today is Tuesday, November 4th, 2025. Present with us of the Health Department is Pam. Pam, you want to lead us, please?
Thank you. We have had a pretty busy season. October is one of our busier months with respiratory virus season and trying to get vaccines to people. And that includes not only our 3 offices, but also a lot of site visits. So we go into all the local schools, the long-term care facilities, and we do quite a few home visits too. So that's kept us pretty busy. It's been a little bit of a complicated time because we didn't have the guidance for the COVID vaccine before we started administering influenza. So we're going to have to shift back and do some COVID vaccine in some of those facilities we've already been in, because we do have everything, including vaccine, so it's been a lot of coordination and a lot of time, and thank you for letting us have 2 cars during the month of October. We've used both of them.
I figured you were probably getting good use out of it. I hadn't heard
We
anything.
have used both of them, so that is on my agenda to talk to you about too, is the car. But we aren't seeing any influenza in Jefferson County yet. We've had quite a bit of COVID. Of course, not all of it is reported because any home tests aren't, but anything that's tested and confirmed in a facility like a hospital or a lab or a long-term care facility is. So we had an outbreak in one of the long-term care facilities, and 2 others we had a case. One case doesn't constitute an outbreak of COVID anymore, so then we watch and do extra surveillance and testing in those facilities. So the 2 we were watching didn't end up being an outbreak because we were able to contain it to the 1 person. So that was good. That was good. Other things have been pretty typical things that we are investigating frequently. We did have a couple of cases of syphilis, though, which aren't always on our list, and they were also in a care facility. So those sorts of things happen. I also met with Mickey Latexier Bullock. I'm not sure what last name she goes by, but she works for the Department of Corrections with the women's facility here, the prison. And some of their residents are needing some vaccinations. So we worked to look at coordination for that. So like I said before, if, a bigger facility comes in, it is going to impact us with, what we do with investigation and what we do with providing gap service. So DOC can provide a lot of their regular vaccinations, but this was for an HPV, which they don't stock, and they wouldn't want to buy 10 doses because it's $4,000 to do that, when they're only needing a couple. So that kind of thing would be a coordinated effort with us, looking at that access to a vaccine and being able to provide it to the facility. So I think we've worked out a way to do that. I just wanted it to be pretty clear in the beginning, because one vaccine is one thing, but if we've got more people and we're doing more, that's going to impact how we go approach it. Another thing we've been talking quite a bit about in our department is WIC and SNAP benefits aren't being distributed right now, which is going to impact our population. And we're wondering if there are things that we can do as county employees to help that. And I don't know what that looks like as far as, having a food drive or, obviously we can get information out, but are there other physical things that we can do? And that's kind of a question that we have. We have holidays coming and we have people that, aren't going to have benefits. Tana's been doing some research for me to look at formula, because if babies can't get formula, that's detrimental to them. So we didn't know if we could do kind of a drive for those things. Often a food bank doesn't get things like formula. And if WIC benefits aren't being provided, then we know there are families that aren't gonna have those resources for their infants.
We're not doing WIC anymore, are we, at our office? We don't.
Do
have a
what?
WIC.
We don't provide WIC anymore. They didn't give us enough money to do that. So what we do with Tana as a home visiting nurse, she does see those patients and clients,
Okay,
but then she refers them to Butte or to Helena, depending on where they want to go. So she has the knowledge and the connections to that, but we don't provide the service, but we refer.
so it'd be nice, I mean, if she sees a need to be able for either the county, for us to do it through volunteerism or donations like that, or can the county put aside a little bit of money so you can buy formula, so she can provide formula for the ones that she knows that desperately need them? I don't know, I mean, there's a couple avenues there, but
Yeah, and I don't know if there's any budget for that kind of thing. I mean, I don't have any in my budget for emergency formula. So I guess I'm kind of throwing it out there for you guys to kind of think about that with me. And you know, if we do decide to do some sort of a project, I of course will run it by you before we do it, but I just, it's on our minds and something that we're concerned about right now, so.
I think between the formula, baby formula and WIC and the food, what is it, the food share or whatever over here, and probably not just here, but.
So
Whitehall got a
we
food
won't have any WIC benefits in Montana after November
share? Okay,
if the state government doesn't do a supplement, because there are no federal WIC. I mean, right now, the state is doing supplemental funding for November,
okay.
but after that, I
Are you-
mean, there's the potential that there won't be funding.
Are you tied into the food share outfits?
I know both food shares in Whitehall and
Okay.
here. Priscilla and I talk frequently about things.
Cause that would be good if we had a connection to them, cause if there's a need, I would like to know about it. I'm assuming these guys would too,
Yeah,
to figure out if there's holes that need to be filled.
yeah,
During this bad time. Hopefully it comes back online.
I
fairly
hope
soon,
so too.
And it won't have to be an issue, but if there's a desperate need and the food banks are struggling, I would like to know about that.
Well, you know, holidays do tend to be times when people are very generous.
Yeah,
Especially if they know that there's a need.
Yep,
So I'll do a
absolutely.
little outreach and see what we can figure out, but like I said, we're really pretty concerned about our babies and lack of formula, because like I say, a lot of times food shares don't have formula. And if people aren't having benefits, those resources that we have right now are gonna be hit more heavily than what they normally are.
was it Carolyn that used to do the food share drive throughout the county? Somebody used to do it when I
Yeah.
first started.
Carolyn did.
Carolyn, okay. So maybe that's something we can get going again, at least for this season.
I think it would be an opportunity for us as county employees to really have a positive face and foot forward for our
Yeah.
community. If, you know, there's some way we can do that and organize that, but
Do you know enough about that, Helen, that we could not have to reinvent the wheel, how that program worked? Did she have boxes?
But I can reach out to Carolyn because I know she would get like corporate sponsors. But I'm sure everybody's going to be getting hit up left and right, you know, town
Yeah.
pump and,
well, and rather than just silo and each of us try to do our own thing, we could do something bigger if we all work together as a
Sure.
community to do it. Rather than, you know, each little department trying to do something.
Well, whatever we can put together, I'd be glad to help, whatever it is.
Yeah,
whether
I
it's
think it'd
like-
be, like I said, I think it'd be a great opportunity if we did this.
I think people are more apt to give if they have an opportunity to give.
And
know, they
if
won't go to the
if
food
there's
share.
some sort of organized way to do
Yeah.
it. And sometimes money is part of what
Mhm.
people need too, you
Sure.
know,
And a
than,
lot of people would rather give money than cans of food.
right, well,
know.
and then we can fill in gaps with what's needed with
Yeah.
money.
Yeah, why don't you work on that, and
Okay.
Helen will get with Carolyn and see what she used to
Okay.
do, and maybe we can get something going for the holiday season here at least, and
Yeah.
like I say, hopefully this,
Helen, after you hear from Carolyn, maybe you and I can connect and talk about where we're going.
okay.
Sound
Just
good?
a train of thought.
Sounds good.
Church ministries.
See, I think we need to involve our faith.
Because they've been involved down in
Organizations,
Whitehall before,
yeah.
and just recently have been.
Well, the faith communities play a huge place in not only identifying needs, because if a family's struggling, often they go to their faith leader, but also in providing resource. So yeah, I think the faith communities need to be involved. I know BTAC meeting is on Thursday, and I'm not sure I'm going to be able to attend in person. If not, I'm going to send an email saying that this is something I think as a community, can we talk about this and find ways to help our people. All right, and then we plan to attend the active shooter training. All of our staff does. Unfortunately, the only day the nurses can attend is on Friday. We can't do Thursday, which means we'll need to close the Clancy Clinic that Friday in order to attend. So I've got your blessing. I'll put some messaging out that we won't be in that day to that clinic.
You have my blessing. Yeah, that should be a
Okay.
good training.
Mhm.
And then with the car, we've all taken some time to drive the Forester and really do like it. And we found out that our snow tires will fit it. So if you're good with that, we will claim ownership of the Forester and put our snow tires on it. And then as far as the other car, we've used both. We're fine if you just leave it parked there. There's space for it.
Okay.
But you give me direction on what should happen with that second car, and if when we use it, we need to check it out, or you talked about having it available to the whole county, or however you want to do it, but
Okay.
it's fine parked there until you find something out.
Yeah, if you're using it fine, like right now, just do what you're doing and we'll figure out what we're gonna do. We don't really have a use for it. I mean, Helen
No.
goes back and forth to the post office is about all we do. She'll drive it out of town once in a while, so just put that in your mind, Helen, if there is that other Subaru that if you need to do a meeting out of town that's available, you just gotta coordinate with Pam here to get it.
Okay,
And the keys to it are always hanging in our front office.
Okay.
And so somebody's available to get those.
And I've got
then,
that extra key on my desk for that.
oh, I
Forester
know,
too, so.
I'm sorry, I didn't respond to your email. I saw it and it was,
No, I
wild.
figured you got busy. It wasn't a big deal. I just wanted to make you aware of that, so.
I'll stop in and pick that up. Another thing that we have access to right now is DPHHS through their department, their Public Health Emergency Preparedness Department has offered us an amendment to our task order. I know you guys love that when I do that, but it's we are eligible to receive up to $10,000 in reimbursement. So they won't give it to us unless we use it to support preparedness and response activities related to avian influenza flu, the regular flu, and other respiratory disease threats. So it seems like a no-brainer to ask for it because we don't have to use it if we don't have a purpose for it. But we've also been talking in our staff meetings about how to use that money. I mean, 10,000 is a gift. But we also don't want to just like buy things that'll expire. So Jesse's had that idea of the monitors in, public places that can provide emergency response sort of notifications. This might be an opportunity to actually move that forward. So on November 20th, I'm going to a meeting to find out more about that. But I think if you guys are okay with that, I think we should just sign that task order, which is on my desk now for approval, and then it'll be sent to you, Dan. And then, like I said, if we don't have a purpose for it, we don't get the money. We have to send in claims
Oh,
to
okay.
get
So
the money.
is it a reimbursement thing or?
It is.
Okay.
Yeah, it's totally reimbursement. So if we don't use it, we don't get it. So if you guys are okay with that, I'll pursue having that sent over. And Dan, if you have questions, just reach out to me and
Okay,
But I am gonna go to that meeting on the 20th. It's in Missoula. It's a regional FEP meeting. Just to get more information about it and ideas about what people are doing so that we can make a really good decision about how to use the funding. But that is one of the things we thought about because it can be used for information. And if we can do that, I mean, not only would public health use it, but DES, law enforcement, messages could be sent through this system for whatever's going on, and they'd be at town pump, you'd have a TV screen set up, or at the grocery store, in
Mhm.
public places, and we could put them in 3 locations. And then I don't know who's gonna manage it. I don't know all the details of that. So before we jump, we would make sure we know the whole strategy, but it sounds like a really good idea. And Park County did it. They have them in their grocery stores and some of their gas stations. And they're able to get emergency information, similar to what we'd get in the text, but it
Mhm.
gets out to other
Right.
people that aren't used. I mean, you just have to get information in multiple venues to reach, the most people. So that's really what we're thinking about. I'm gonna make sure that that is something we can use the funding for, from the state partners, but FYI, I'll leave this kind of tells a little bit about what can be used, that funding can be used for. And if you guys have ideas, we're always open to that. Like I said, 10,000 isn't a ton, but it's nothing to be sneezed at either. We could actually do a project with it, I think. I have a bunch of staff things going on. I thought I'd update you with. Molly's partner Mike has recently had a heart attack. He went back into the hospital last night. They're thinking it's pericarditis, which is inflammation and maybe infection around his heart from the procedures that we're doing. So they're doing an echo today to make sure. Sometimes you have a precursor MI and then you get a big one. So they're hoping that that's not what's happening. So she is out of the office today. And I basically said, just keep me informed of what your needs are and take the time you need. She has plenty of sick time she can use. And then Tana is scheduled to have a surgery on November 20th. So she will be out recovering for a little bit of time there. During her recovery, she can probably do some of her work at home. So if you're okay with that, I will authorize her to go ahead and keep up with Midas and things like that she can just take her computer and do at home, which will take stress off from us. And then we did hire Rochelle Husford for our behavioral health coordinator. So we've been working on onboarding her.
Did she start already?
She's
I thought she
I
did.
think this will be her second pay period. So she started right away. We've gotten her through, the HR process, this clerk and reporter process. I had to order a computer and a phone for her work. So she's going to meet with IT this week. So she's kind of slowly getting through all that. She doesn't have a lot of hours that she can give us, but, so it's a very part-time position. And we set up to 20 hours. She probably can't give us that, but they said that they will extend that money. So even if it's past that 2-year contract, we can still use the money to pay her if we continue her employment. So I think those are my big things on my list.
if Molly's gone, I mean, if it turns out she has to be gone for a while, who will take the calls for the sanitarian?
Well, that's another issue I think we need to be talking about. Matt had the phone transferred back to him,
Oh,
so
okay.
he's doing that, but then he was in my office when I left and I was talking with him for a minute. I think there's, some concerns there with how he can get his job without having support. So, we probably need to look at how that works. And we've found a few kinks in this whole thing that I don't think it would be bad for Matt and I to sit down and work at and maybe involve you if we need to, but yeah, it's gonna be a stress on Matt too.
Yeah, I'm sure.
The thing, I don't know, it's come to my attention, but to the DI task force, Barb is no longer being funded to Butte. Now, with the mental health, is she being funded in any way to present that?
No.
So she's just a volunteer of all of this? That's how it works?
What she told me is there was some DUI task force funding for her, but I have no knowledge of that. That's just what she told me. So I don't know. I know she wants to stay involved.
Right.
And I don't know that volunteering is out of the question, but
No, I
if you
understand.
put a lot of time in,
No, it's just,
But the prevention specialist is not funded.
the prevention specialist is no longer funded. So
yeah,
Butte Cares had 12 employees that covered the region, which is quite a large region. And now they have 3 positions, whether they have full-time positions or whether they're part-time. And I don't know what they've decided. I know Esther Lynn's was Madison's, and I think she'll be covering Jefferson now.
oh, okay.
And I don't know however many more, but we're not gonna get this amount of service that we did when we had Barb.
Right, so I guess what I'm looking at, just like what Craig says, prevention specialist, that sort of takes her out of that realm now. She'd be more of a volunteer.
Mhm.
So I don't know, and I'd ask the same because I don't know about the mental health side. So if she's chair or whatever she might be, that would sort of relieve her of that duty, would it not, at this point?
Unless she
Unless
volunteers.
she wants to volunteer for it.
Yeah, I mean, the way the bylaws are with the mental health LAC, and I don't know about the task force.
Right,
But with the LAC, the bylaws do have, resident people that are involved. So as a volunteer, she could be there. She wouldn't have to be employed to do.
I just didn't know about that position as such, as opposed to someone that's in there
Yeah.
that oversees it
Yeah.
all, but yet can still be on there as a volunteer.
Yeah. Yeah, we don't have the funding to, which is distressful. So yeah, I don't know how much and I know the other thing that she's expressed to me, and I think, like I said, some of that volunteering she's amiable to,
Mhm.
but she doesn't have equipment, she doesn't have a computer and those sorts of things, and
Right,
that's a barrier for her because she doesn't have her own. So,
I know, it needs to be something discussed in the task force and then mental health or what, so
yeah,
here in the near future, real soon.
so,
Just thought I'd ask. All I have, gentlemen, you have anything?
Matt and I are working on the update of the wastewater fees for his office. And they'll probably have to go in front of the health board, just so you know, they're gonna have to probably okay it, then it'll come to us to regularize somehow in a resolution or somehow.
okay,
We cannot find any kind of a action taken by the commission on any of these fees in the past, so
okay,
we're kind of trying to work our way through it, but
okay,
I think it'll be just as simple as the board approving it to the commission and the commission approving it, and it'll be set. So just so you know on that, and we're trying to get a meeting set up for the building, the idea of the Elkhorn building being gifted to the county for the health department and so we would own that building instead of just be leasing it. Trying to get that set up, so it's like chasing cats. Every day I pick somebody's out, so
Yep.
I'll probably end up trying to get what do they call it, a doodle poll or something out where I can put a whole bunch of
yeah.
dates and just have everybody pick and
That's
try to pick the best
what-
one.
Yeah, so the 19th isn't a go. Okay.
Well, Ginger's not available the 19th. I was gonna
Okay.
talk to her and say, do you really need to be at this meeting? If she says she doesn't need to be, then I might proceed forward unless somebody else bows out too, so.
Yeah, it's almost impossible to get the whole crew there at the
It
same
is.
time,
Yeah, especially during the holidays.
as long as you
it's-
get the key people there.
Right,
Well, I appreciate it. I think it was the idea we started with building expansion was to look
Use
at the
that building,
building we're
yeah.
in, so,
that would be, I think, in my opinion, that would be a huge benefit to the county to be able to take that building, and then we'd have the money to do whatever we want with it. We could expand it we've already got an expansion plan on it, can we make that bigger, you know, do something with it, and then that would be such a nice building for the county. as a
No,
whole.
it feels good.
Mhm.
It feels better than
The
the other
river or
option.
whatever, yeah,
Yeah.
yeah,
So
it would be ready to go, you know, we wouldn't have to mess with.
I think we
anything.
could do it in a hurry,
Yeah. Yeah.
which I
so-
know is a concern with funding, so.
And it would help this group out too, that's been trying to keep this building going. I mean, Christina, you know, she's the chair of it, and she's like a property manager. You know, she's having to do this and having to do that and keep the thing going, and she's.
Christina is extremely responsive,
Oh, yeah.
and she's done a lot to help us. I mean, we've had the remodel, we had an infestation of mice. I think when they redid the Bell House, they must have created an environmental shift
Hmm.
because they
It
came
doesn't
in.
take much.
It doesn't, and
Wow.
so we've had mice, and she's been extremely helpful with that, so,
Good,
yeah.
good. Yeah, so I'll try to get that meeting together and we can discuss that and see which way we want to go. We still don't want to pull the rug out from Leah, I don't think at this point,
No.
you know, on that other thing, but
Well, I don't think that the vision for Cottage 5 as a medical arts plaza needs to be thrown away, even if
Right.
we do this.
yeah, no, I agree.
I think, but that's a long-term vision.
Right. It
That's
is.
kind of what I said, which is why I started the process again, because that's still viable, it's still there, but it's not
It's not
a
gonna happen tomorrow.
short-term fix
no.
for anything, I
Yeah.
don't think, and so I'm glad that this came up out of that conversation, and hopefully we can figure it out.
No, I think it's a good idea. I do, so I'm all on board.
Good. Glad to hear that.
Okay,
Good.
are we still recording?
We're still recording. Yep. I will shut the recording off and our chairman, okay to shut the recording off, Mr.
Absolutely.
Chairman? All right,
Meeting adjourned.
meeting adjourned.